What causes hypertension? There are now undeniable evidence that sodium raises blood pressure, and excessive salt consumption is now thought to kill almost 4 million people every year around the world. Hi, I'm Dr. Mura, a certified lifestyle medicine physician and co-founder of Dr. Mura Health. In this short video, part 1 on what causes hypertension, I'm going to show you how excessive salt consumption is detrimental to your health. So let's do it right now. Sodium raises blood pressure by increasing osmotic vascular volume. Simply put, by eating too much salt, your body is going to hold on extra water to try to wash out or neutralize the salt in your body. So it is this water retention that exerts pressure on heart, causing blood pressure to go up. But sodium intake does this also by causing what we call endothelial injury. Now, endothelium is a thin layer that lines the inside of your heart and the blood vessels. Endothelial injury is the beginning of problems such as atherosclerosis, heart attack, and stroke. By the way, this endothelial injury happen independent of your blood pressure being high, in case you may be thinking that your endothelial are healthy just because you don't have high blood pressure. Salt is a compound made of 40% sodium and 60% chloride. Sodium is essential nutrient, but the vegetables and other natural foods contain a small amounts of salt that our body needs. And for the vast of human existence, people eat a small amount of salt, probably about maybe quarter teaspoon of salt per day. And this is because the diet has been mainly plants. After human civilization, when people started realizing that they can actually use salt to preserve food, salt started becoming everywhere, and the results of hypertension is also everywhere. There are studies now that show that by reducing your sodium intake by just half a teaspoon per day, you can reduce 22% of stroke and avoid 16% of fatal heart attacks. Now, of course, the evidence that sodium causes hypertension are everywhere, but also the evidence that if you reduce the amount of salt you eat can reduce your blood pressure is everywhere. One the doctor who first demonstrated this was Dr. Kempner. Dr. Kempner in 1939 took a patient whose blood pressure were 240/50. Now this is super high blood pressure. This is what we call a malignant hypertension. With this blood pressure, patients started becoming blind because literally your small vessels in your eyes are popping out. The kidneys start shutting down. The heart attack and the strokes are imminent. He took this patient and he put them on a diet that was low on sodium, low fat, and protein. And this diet was composed of a diet of fruits and rice. And to the surprise, he managed to lower these patients' blood pressures from 240/150 to 105/80. Now that is the power of lifestyle change. From 240/150 to 108/80. There's no anti-hypertensive medication that can give such a result. Now, how much salt are you eating? The American Heart Association recommends that the salt consumption be limited to about 1,500 milligrams per day. Now, that is about almost half a teaspoon of salt. Just to give an idea, 1 teaspoon of salt contains about 2,400 milligrams of sodium. So it's very important to notice how much sodium you take. By the way, this is not only to see how much salt you add in food. Like I just mentioned, salt is everywhere. The food that you buy in the supermarket are preserved with salt, the chicken, meat, and other packaged food. Be wise to always check how much salt contains the food that you buy by reading the labels, because your life may depend on that. Stay tuned. We're going to talk more about other causes of hypertension. Thank you so much for watching.